Hello, darlings. The Cabiola here. Welcome to my channel and thank you so much for staying tuned. In my last video, I spoke about the 7 steps of nursing and I've received some DMs regarding that. Some people want me to make a video on the 7 steps of nursing, and of course, I remember saying that I was going to drop a video regarding the 7 steps of nursing. So, yes, here we are today. Let's dive in. So basically, when we talk about the 7 steps of nursing, these are the steps that you take when approaching your patients, either to carry out a procedure on them or to give them an information. And the first thing on the list is you want to assess your environment for safety. You want to be sure as you're approaching your patient, the environment is safe for your patient and yourself to approach. So when you go for your OSCE, and you have a particular station that has the patient seated there, you want to verbalize it, and also they want to see you check, like just do a visual check, more like you're doing a visual examination of the environment to see that your environment is safe for you and your patient. And you're going to sound like, I would assess my environment to ensure safety for my patient and I. And you're going to also verbalize it, confirming that your environment is safe for your patient and yourself. So you'll be like, for example, I'd assess my environment for safety. My environment is safe for my patient and I to proceed, which is fine. The next thing, and when you're assessing environment, also check the patient's surroundings, especially for mental health nurses, when you have a patient with some mental disorder, maybe depression, you want to check if they don't have any objects that can harm them. If they have objects that can harm them, when you take a content, you're going to ask for permission to take off those objects that you feel can actually harm them. So that's it for assessing your environment for safety. The next thing you also want to do is to sanitize your hand or wash your hand. Aside hand washing, we now have sanitizers that you can use to sanitize your hands. And please, regardless of how rushy you are, you want to ensure that you follow the hand hygiene procedures, the 7 guides for the hand hygiene procedures. Please follow them because they are watching. They want to be sure you're doing it the right way. So when you're done sanitizing your hand, for the purpose of this exam, please read your scenario. If it's in the field, if it's a clinical setting, you know that you, before approaching the patient, you know why you're going to your patient. If you're going for a procedure, if you're going to give them an information, if you're going for an assessment, you know why you're going. You must have read through the patient's folder or the patient's documentation. So when you're going for your OSCE and you've done the whole assessment and everything, please read your scenario, know the reason why you're going to that patient. It goes a long way. The next thing you want to do is to don PPE. That's your apron, your glove, but mind you, that's for a station that needs you donning PPE. If it's a station that does not need you donning PPE, then you do not have to worry about donning PPE. So you don't doff your PPE. But if it's a station that doesn't warrant that, you don't have to worry. The next thing you want to do, guys, this one some people forget, is you want to introduce yourself to the patient. Please don't just go to the patient and start acting magic. Go to your patient. Of course, you've assessed the environment, you've sanitized your hand, you're safe to approach. Introduce yourself to the patient. Hello, how are you doing today? My name is the Cabiola and I'm your assessing nurse for today, or I'm your attending nurse for today. Do you understand? So please ensure that regardless of how in a haste you are, you need to calm down. You need to introduce yourself to the patient. And after introducing yourself to the patient, you also want to get the patient's details. That's where your identity check comes in. You want to do your identity checks for the patient. It depends if it's an hospital setting or a community setting. Just do your identity check. You know what the identity check entails. Do your identity check, please. Now, I used to say this cheat, my cheat that I tell people who are around me When you do your ID checks, please also ask for allergy. It helps you even if you forget later because you've asked from the beginning. It's safe. So always ask for allergy when you do your ID checks, and also follow it up with the associated effects. This way, even when you forget later, you really don't have anything to be concerned about because you know that you already asked about the allergy, and of course you're safe, you're covered, because asking about allergy actually has its own mark. So you have to take note of that. Then you want to seek consent from the patient before proceeding. Don't just go and start acting on your own. You want to ask the patient, are you happy for me to proceed? Of course, if the patient tell you yes, then you go ahead. Of course, the patient will tell you yes, it's OSCE, it's an examinations, and they are also there to act a role, but you still need to ask because there's a column, there's a mark for you asking. And of course, the more you gather the mark, the more accumulated your mark becomes, and of course it makes you have a upper chance of passing the examination and not the other way around. So please always seek consent from your patients. So once you're done with seeking consent and taking permission from the patients, you want to explain the procedure to the patient. Oh, Miss Brown, today I'm here to carry out a procedure on you, and this is the reason why I'm doing this procedure. This has been, explain the procedure to the patient, tell the patient the reason why you're doing what you're doing for them so that they have an idea of why you're there. And not that you just go and then you just start acting on your own. Patient to start wondering, like, okay, why are you here? What are you doing? You know? So please, those are the 7 steps of nursing. Yes, that's it. We've come to the end of this video. I wanted it short and brief. Hopefully, this is not too long, but that's what the 7 steps of nursing entails. If you want further explanation regarding this, please and please kindly reach out to me, and I'll be glad to be of help. Okay? Thank you so much for watching. Thank you so much for always coming back. Like this video, share, comment. Let me know your thoughts in the comment sections, please. And please subscribe to my channel. Thank you so much. And once again, this is the Cabiola. Bye, darlings.